Bismillahirrahmanirrahim. This lecture is about body reaction to injury. Of course, you know that the body has very good power of healing itself. If there is a wound or there is disease, infection or whatever, the body starts or try to clear these things. If there is wound, it will start to heal the wound, and with bacteria, it will start to combat the bacteria. So this is about the reaction of the body to injury. So the element of healing for this process we are speaking about here about wounds. Infection is another process, but elements of healing start with epithelialization. Epithelialization, which this epithelialization is triggered by loss of contact between epithelial cells. Of course, if you have a cut wound, for example, in the skin by a knife, you separate the epithelial cells. They are no longer in contact with each other because the wound separates the epithelial cells. So loss of contact between epithelial cells, this will lead to proliferation and migration of cells at the edges. When you make a cut wound, there are two edges. These edges become separate because of the cut wound, and cells on these edges start to proliferate and migrate so that they can close, or the gap between these things, they are cross it and they heal the area. Other factors will lead to start of the epithelialization is growth inhibitor. And the third factor is moisture. Highly oxygenated environment enhance rapid growth. So you have three factors: loss of contact between epithelialization, growth inhibitor, and moisture. These are three factors which help into healing, the start of the healing process or the epithelialization process. 2. Contraction. This is the second element of healing, is contraction. It is a normal step in healing to make the gap of the wound smaller. He said that the cut wound will separate the epithelial surfaces, and this gap, if the tissues contract, this will decrease the gap between these epithelial surfaces so that the epithelial cells can cross and make the healing process. And this contraction is done by myofibroblasts that have contractile power. These cells, they have contractile power, so when they contract, they become smaller and they pull the two sides of the wound together to decrease the gap. This contraction in the healing process is different from the scar contraction. Scar in burn or whatever, scar contraction is different from this. Scar contraction is called cicatrization. Which is pathological. Scar contraction is pathological, and you can look to this picture and you can see that this is burn child, and you can see contraction on this. When this contract, this is pathological, and this will lead to decrease in the area of the skin. That's why it becomes tight. The area contracted after burn is pathological, and that's why the skin becomes smaller than normal and it becomes tight. If it is around the wound, it becomes tight and it leads to problems. You will have this in burn. The third factor in element of healing is connective tissue formation. This unites the edges of the wound deeper to the superficial fascia. Connective tissue formation. The body starts to make connective tissue, and this deeper to the superficial layer. And this connective tissue will lead to the healing process or enhance the healing process. Types of healing. These are the three healing: epithelialization, contraction, and connective tissue formation. These are the three elements of healing process. Types of healing. Number one, healing by first intention or primary healing. Healing by first intention or primary healing. This occurs in clean wounds. The wound edges are approximated by suture, for example. They are in clean wounds, and these clean wounds are approximated by suture, like in surgical wounds. If you make surgery, it is clean wound, and then you suture this wound after you complete the surgery. You approximate the edges of the wound, and this heals by epithelialization and connective tissue formation, as we said in the steps before. It heals by epithelialization and connective tissue formation, because you have sutured the wound, so you decrease the gap between the two separate epithelial surfaces, and this will make the healing process easier, and so that is first intention. You can look to this picture here. On your left side, you can see clean incision, and in the middle, you can see the early suture. The wound is being sutured, and this is the result of suturing the wound, which you can see very thin scar. You can see very thin scar here. This is the scar, very thin scar, because you have sutured and approximated the wound, and the scar become very thin, and you can see these suture. These are suture.